So today's $1,000,000 question is, can you cure herpes? And the answer is no, you cannot, at least as far as I know. But you can certainly knock it down significantly. And as I've kind of talked about in different videos in this series, you will at any point, if you catch whichever one of the 8 types of herpes that there are out there, once they infect your body, they have mechanisms for making sure that they continue to infect all the future generations of that infected cell. And so because herpes viruses stay dormant, it's difficult to always treat them. They, however, can still hurt you even when they are not active, and in many people that can manifest as, say, chronic prostate infections or chronic vaginosis or recurrent vaginal yeast infections, and somehow the immune system doesn't seem to be able to deal with these recurrent infections normally, and that's because the underlying problem is that there's some viral activity, either in terms of actual active outbreaks or in terms of the dormant virus releasing things that reduce your immunity and predispose you to bacterial or fungal infections. In general, these cannot be cured, but with high doses of antiviral treatment, the herpes can be knocked down. There are supplements that can help to make the treatment more effective so that the cells are always in the same cycle, so that if you time the antiviral treatment correctly, then you should actually be able to reduce the severity of the disease and reduce the number of cells that are infected, which does not happen if you just take a medicine like acyclovir or famciclovir on an ongoing basis. You will never reduce the infection. You'll just keep things potentially under control, but eventually develop resistance. So my suggestion is always to take a course of intensive supplements and medications simultaneously for a few months, and then reduce the number of cells that are infected, and that way the course of infection should be milder going forward, even though it will not be eliminated completely.